Doctor, we will wait for 2 minutes more. ಆಮೇಲೆ ಸ್ವಲ್ಪ ಜನ ಜಾಯ್ನ್ ಆಗಲಿ, ಆಮೇಲೆ ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ.
Okay, sir. Okay, no problem.
Yes.
ಹಲೋ. ಹೇಳಿದೆ. ರೆಡಿ ಇದೆ. ಶುರು. ಜಾಯ್ನ್ ಆಗಿದ್ದೀನಿ. ನೀವು ಅಕ್ಸೆಪ್ಟ್ ಕೊಟ್ಟಿದ್ದೀರಾ? ಓಕೆ. ಓಕೆ. ನಂದು ರೆಡಿ ಇದೆ ಸರ್. ಸ್ಟಾರ್ಟ್. ರೆಡಿ ಇದೆ. ಸ್ಟಾರ್ಟ್ ಮಾಡಿ.
ಡಾಕ್ಟರ್ ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ. Yes, sir. Uh, Good afternoon, everyone. Good afternoon, all Vaidyas. A very warm welcome today for today's continuing Ayurvedic education session (CAE) presented by Ayo Center and co-powered by Ayurveda One. I am Dr. Pampa Shankar, and it is my pleasure to host the 16th pre-webinar session. So now onwards, it is newly titled as Insight. It is truly encouraging to see so many doctors committed and encouraging our CAE sessions. Thank you for taking time out of your busy schedule here. So today's session is designed to be practical and experience driven, covering treatment approaches, key formulations, and strategies which have consistently shown positive outcomes in clinical practice. So let me give you a brief introduction to our institutions. Ayur Central. Many of you are already familiar with Ayur Central as pioneer in organized Ayurvedic healthcare. From our first clinic in RT Nagar, Bangalore, we have grown to a network of 72 clinics across Karnataka.
అది కర్ణాటక
Supported by a team of 120 plus experienced Ayurvedic doctors. Today, Ayur stands as India's largest Ayurvedic clinic chain, serving patients through both physical clinics and strong digital. Our commitment is steadfast to make Ayurveda accessible and impactful. Ayurveda One. Our system concern Ayurveda One focuses on developing doctor-formulated, research-driven, and result-oriented Ayurvedic medicines. Through Ayurveda One, our goal is to make high-quality Ayurvedic formulations available to practitioners across India with valuable precision, safety, and results. So, before we begin, there is important announcements. The link to our official channel has been shared in the chat. Will be shared in the chat. Please do join and to stay updated about our future CME sessions. Kindly ensure that your email ID is correctly mentioned during registration to facilitate smooth certificate delivery. Today's session will be approximately 1 hour in duration. You are welcome to post your questions anytime in the chat. They will be addressed during the Q&A segment. For any technical issues, our support team is available via chat. Lastly, please make sure to share your full name and correct email ID in chat box. So coming towards today's topic, Ayurvedic approach in Katishoola, unfolding the treatment of lumbar disc pathology. So in present era, lumbar spine disorders have been increasingly prevalent due to prolonged sitting, improper posture, sedentary lifestyles, repetitive strain, stress, and lack of adequate physical conditioning. So these factors significantly contribute to disc degeneration and chronic low back pain, making Katishoola a common clinical presentation in daily practice. So for that, we have today with us Dr. Shankar Prasad, the Associate Professor and PhD Scholar in the Department of Postgraduate Studies in Chalyatantra at Alva's Ayurveda Medical College. Dr. Shankar Prasad is widely respected for his academic excellence, depth of clinical experience, and his ability to seamlessly integrate classical Ayurvedic principles with contemporary clinical practice. His areas of expertise include neurological care, wound and chronic ulcer management, spinal disc-related disorders, colorectal diseases, Anushastra Karma. He has authored several scholarly articles on topics such as Jushtavrana management and the utility of Shara Sutra and Bhagandhara and the concept of Agni Karma. He is also a postgraduate guide and a frequent speaker on national and international platforms including AFI and Ayurveda, Vishwa Ayurveda Parishad. Without any further delay, we will hand over our session to our speaker. Sir, welcome, and the session is yours now.
Thank you, sir. So I'll directly start with the session.
कुछ तो ना आज काय मिलेश नाही ना
Is it visible, sir?
कुंजी देने के ना
Yes, sir. It is visible.
Am I audible properly?
Yeah. Yes, sir.
Yes. So let
Sorry
me
to
start with
interrupt.
directly.
May I request all the participants to please keep yourself under mute so that the session
Good
can
afternoon.
go seamlessly.
Good afternoon, everyone. Today I will be talking on a topic, Ayurveda approach in the Katishoola and how to diagnose it and treat it. So in this presentation, there is a lack of time, but within the scheduled time, I'll try to cover most of the things, but maximum of the diagnosis part, because we know a lot of things regularly we come across with a lot of patients with the various presentations of back pain. We know the causes, but we are lacking, as I saw, we are lacking in the diagnosis, how to diagnose that condition through Ayurveda. So let me start with the presentation directly. So there are two case scenarios. I will be presenting one. There is one patient who is of 35 years old, comes to OPD with the low back pain acute on lifting the bucket since 5 days. And he walks with stiff back, and on examination, the straight leg raising test was negative. This is one scenario I am giving. And in one more scenario, a patient of 65 years old man comes with chronic low back pain since 4 weeks, and now the pain is increased. But on examination, there was no radiation of the pain, and the pain increases on activity, and it is better at the rest. And there is also a night pain present, and on examination, all the neurological functions were present. So these are the two scenarios with the different presentations. So one is the acute pain, which is of inflammatory in origin, whereas a chronic pain, which was degenerative in origin. So these are the two scenarios I'm just giving for the example in the introduction part itself. So now come to the basic information about various aspects of the back pain. So if you take the prevalence of this back pain, among all the causes for the pain, low back pain accounts of about 61% among all different types of the pain among the musculoskeletal disorders. And even in the artificial disc market also, that means the surgical aspect of the various diseases of the spine disorder, materials inside the disc area are also globally increasing. So this acute also, the acute causes of the back pain are more when compared to the chronic according to one study. So the acute is one which causes where the patient presents with pain within 6 weeks of the time. And if it is more than 12 weeks, we consider it as a chronic pain or chronic low back pain, whereas in between it is considered as subacute condition of the pain. So globally, approximately 619 million people are suffering with this back pain, and it is one of the single leading cause of disability worldwide. So let me come to the little bit information, more depth of the lumbar spine. So the lumbar disc, I'm not talking about the cervical spine at this juncture. I'm talking about more about the lumbar spine because we get a lot of cases with different presentation. So let me try to guide something how we can diagnose before going to the treatment. So this lumbar vertebrae is having a specific of L1 to L5 vertebral bodies are present, and where the vertical height is less than horizontal diameter. So this design is mainly for wearing the weight of the body or the weight of the spine. So vertebral arch helps to protect the neural elements. In this picture, you can see there are different very important structures in the vertebral body like spinous process, and at the two sides there are transverse process, and in between you have the pedicle and the lamina is present, and there is a neural spinal canal where the nerve root is exiting. And there are some of the ligaments, anterior and posterior ligament, they mainly help for the stability of the joint and also for the flexion of the vertebral column. So a little bit about the anatomical aspects. As you know, the lumbar spine starts from L1 and ends at L5, and there are nerve root are exiting, and between vertebral body there is a disc space, or the disc is present. For example, L3 L4 disc, we say L4 L5 disc, the nerve root which is exiting is coming below that disc. So for example, if it is a L4 L5 disc, the nerve root which is coming below is called as L5 disc, L5 nerve root. So the blood supply to the lumbosacral spine comes from the branches of the aorta, including the 4 pairs of the lumbar arteries. So coming to the ligaments of the lumbar spine, this is very important. There are anterior compartment and the posterior compartment. The anterior longitudinal ligaments are helpful for limiting backward bending and vertical separation, whereas the posterior longitudinal ligament runs behind the vertebral body and it limits the forward bending. And there is one more called as ligamentum ligament, mainly incorporates for the back pain causes, and that connects the lamina covering the spinal canal and helps to maintain the curve and the diameter of the canal. And there are in between interspinous and supraspinous ligament, intertransverse ligament, and iliolumbar ligament. So let me come to the spinal nerves. These are all very, very important topics which we usually neglect most of the time. But once you diagnose a case of back pain, all these things are very important, which will help us to diagnose the specific lesion where the problem is existing. So the L1 nerve, spinal nerve, is responsible for the muscle control and the sensory functions of the hip. I'll show the dermatome and the myotome. See, in this picture, you can see the L1 is supplying to the hip and the low back area, whereas L2 supports the muscles and the skin of the upper thigh and the hip. Whereas L3, you can see the L3, which comes to the lower thigh region and it controls the muscle movement, muscles of the lower thigh. Whereas L4 innervates the knee and the thigh muscle, and it plays a role in the knee reflexes. And L5, which is coming to the support of the muscle control of the lower foot, leg, and the toes. So here also you can see the same dermatome and the myotome, which will be critical in diagnosing the neurological issues related to the spinal disorders. So the same thing, I can correlate these things to the Spik Purva Katip Prishta Janu Jangapadam Krama. That is the Kridrasi Shloka has been told, where the radiation of the pain starting from the stick and it radiates and reaches up to the lower toe. So Vatapurna Dhritisparshaha Shotaha Sandigate Anile Prasarana Akunchanayoho Pravritischa Savedana. Even though the condition is in the knee joint, but there is a swelling and into other areas also told in Ayurveda. So let me come to the different causes of the back pain. So if you observe, I'm restricting to the low back pain only. So this low back pain mainly due to some of the inflammatory pathologies, maybe due to some of the degenerative pathologies, impingement of the nerves, or it may be radiating from the other than from the abdominal area or from the pelvic area conditions, or it may be involvement of the sacroiliac joint. It may be a disc herniation, the diseases related to the disc, or it may be a sacroiliac joint disorder. All these conditions are referring the causes of the pain in the low back area. So let me come to the quick examination, how I approach in the examination of a patient. So once the patient is coming with low back pain, first thing is you have to examine the patient in a proper exposure. It may be in the supine, sitting, standing, and the prone position. First of all, once the patient is entering your OPD, you should always see what is the attitude of the patient and whether any deformity is seen or not. So sometimes the patient, some patient, they have the limping gait, or sometimes in case of the caries spine, that is the TB of the spine, they take short and in case of sacroiliitis condition, there is inflammation present in the sacrum and the iliac joint area, the patient will be usually having that side of the that side will be limping gait will be present. So once you observe the patient, you observe any deformity seen or not. For example, one of the the lateral bending called as scoliosis. And in some patients, they have the kyphosis, that is the backward bending. Or in some patient, that is the forward bending, and lordosis is the backward bending may be present associated with the other diseases also. Whether there is any prominence of the iliac crest is present, what is the curvature of the spine, that we should observe. And once that stage is over, then we will go with the palpation. Before palpation, you observe any of the swelling is present in the local area, like in a TB patient, tuberculosis of the spine, there may be a gibbous, there may be a cold abscess, whether there is any sinus, whether there is any ulceration or any neurological deficit you can observe. So once that is the inspection part, then we will go to the palpation. In the palpation, you have to just with your thumb, you have to press that area and see whether localized tenderness is there or not. We call it as doorbell sign. And we have to see the swelling. If the swelling is there, whether it is a localized swelling or whether it is a generalized swelling, we have to palpate and see whether there is any increase in temperature is there or not. We just palpate that area and see. And once we palpate, we will see whether any muscle wasting or any rigidity is present, whether any paraspinal muscle spasm is present, and see the various movements like flexion, extension, and rotation, whether it is proper or not. And we will take the measurement to rule out any shortening of the limb in various fracture conditions. And next, we will do the SLR test, straight leg raising test, and we can see the reflexes. So usually we will not see the reflexes and all the things in a case of low back pain, but this is important to see which nerve root is involved. For example, if you see the knee jerk, if the knee jerk is reduced, that may be a case of involving the L3, L4 nerve root. Or what is the status of the ankle jerk, referring for the S1, and plantar reflex for S2 nerve root. So this is the example what I used to give. See, in this picture, you can see the curvature has been changed and the gait of the patient and the posture is also with the example like lordosis, kyphosis, or the scoliosis you can see. So now come to the special tests. As I told, one of the common tests we'll do is straight leg raising test. What is the implication of straight leg test? So once we raise the leg upward, and if the patient is observing the pain below 40 degree, that is most of the time it is a particular case of intervertebral disc prolapse. And beyond 40 degree, if the patient is getting the pain, it may or may not be because of the IVDP condition. But it is not a specific test. So the further test is you ask the patient to lift, or in a passively you lift the leg of the patient and do a forceful dorsiflexion of the foot. If the patient is experiencing the pain, that indicates the nerve root compression because of the herniated disc. So there is one more test. You do the SLR in the sitting posture, and that will be positive in case of tension on the sciatic nerve. So these are some of the specific tests where we will do. And to understand the involvement of the L2, L3 nerve root, we have one more test called as a reverse SLR test. So you make the patient in the reverse posture or the prone position and try to flex the foot, and then you see whether the patient is experiencing the pain or not. So that indicates the involvement of higher level of the spinal nerve roots. One more condition called as the sacroiliitis, inflammation of the sacroiliac joint, which will be differentiated with the help of the tests like Gillies test and Ginsland's test, and also a pump handle test. Pump handle test is the one you make the patient in supine posture and flex the knee joint and then try to move the knee joint to the opposite towards the opposite shoulder joint. And if the patient is experiencing the pain, whichever the side the patient is experiencing the pain, that side of the sacroiliac joint will be involved. That is the implication we are getting. So this is very, very important as a spot diagnosis in the clinical examination. See, if on a quick examination, if the patient is not able to do the SLR in the sitting posture, leg extension is not possible, that indicates the L4 nerve root is involved. And if the um, dorsiflexion of the foot is affected and the extensor hallucis longus, hip abduction and ankle dorsiflexion is not possible, that indicates the L5 nerve root is involved. And in case of S1 nerve root, the patient will be sensory loss of the leg will be very much helpful to understand which nerve root is involved. So if you try to ask the patient for the dorsiflexion of the foot, so that is not possible in case of S1, and ankle jerk is also diminished in that condition. So better is just ask the patient for walking, able to walk on the toes, then S1 may be involved. So how the presentation in case of different conditions, the back pain will be present. So it will be presented with the pain and neurological claudication, deformity, weakness, and different types of the neuropathy and gait disturbances. And in severe condition, there may be bladder and bowel in how we do the doorbell sign and the range of the movement, which range of the movement, and the special test like SLR, Bragg's test, and what is the status of the muscle bulk, muscle tone, and the sensory examination. So while talking about that, I'll just, there are some condition which you encounter, like there is one condition called as meralgia parasthetica, where the pain will be experienced on the outer aspect of the thigh region because of the compression of the lateral femoral cutaneous nerve. So that is spot diagnosis. If the patient is coming with this type of presentation, then that is a case of meralgia parasthetica. In obturator entrapment neuropathy, patient will be having pain on the inner thigh region, and in a side below back to the MRA, and if the nerve conduction study can also be studied. So this is one of the condition how the MRI will be presented. So in this picture, you can see there is a disc bulge and the degenerative changes at the L4, L5 level, and there is a disc herniation. I'll show how to see in the MRI all those things. So this is a normal X-ray, AP view and lateral view, and the middle one is the MRI of the normal lumbosacral spine. So this is the first picture showing about the degenerative changes. Extreme degeneration is there at the L1 level, L2 level, and throughout the vertebral bodies, you can see the bony spicules. And in the second picture also degenerative changes and the curvature has been straightened, you can see. And the third picture, you can see the displacement of one vertebra over the other. It is overriding of one vertebra over the other. L4, L5, spondylolisthesis can be seen. So this is one example of the X-ray which shows about the compression fracture. And in the third picture, you can see the L4, L5 spondylolisthesis that can be diagnosed easily with the help of the X-ray. So now the important thing is what is the lumbar disc pathology. So till now I have talked about how to see it in the X-ray. So in between two vertebral bodies, there is a jelly-like material which is composed of outer annulus fibrosus and the inner nucleus pulposus. So this nucleus pulposus is not having much of the blood supply. It is a comparatively avascular structure, and with age it goes for degenerative changes. And in the annulus, there will be concentrically, sometimes the patient may experience some injuries, and that leads to the disc material, the inner pulp material, to herniate outside. So this disc material is helpful for shock absorption and also helpful for the flexibility of the movement of the lumbar spine, and it prevents the nerve compression, and because of the avascular nature it is slow to heal and vulnerable to degeneration, and they transmit the pain also. So this is the stages of the lumbar disc prolapse. In the first picture you can see the nucleus pulposus has been enlarged, that is called as disc bulging, and next is the disc herniation without a nerve impingement, and third picture you can see the protrusion of the pulp material, and in the last stage the nucleus pulposus separated from its mother structure and it comes outside as a separate structure, causing the sequestration. So the same you can see here in the MRI. In the first picture there is a disc herniation. So the disc is coming outside and it compresses the neural component. If there is a just bulging happens, that is called as disc bulge. And the last picture, severe disc prolapse impinging the nerve root can be seen. So this is one more picture, MRI scanning, which shows the degenerative changes in the disc area. So there is one more condition of the low back pain along with the intervertebral disc prolapse. It results in the spinal canal stenosis. That is, the picture evidently shows that the spinal canal has been become narrowing, maybe because of the ligament facet joint hypertrophy, or it may be because of the intervertebral disc prolapse, or it may be because of the degenerative condition, or maybe because of the compression fracture. So if spinal canal stenosis is there, it can be presented like the patient may have severe back pain and neurological claudication will be presented. It is nothing but the patient, once the patient is standing up and walking, there will be severe pain. And once the patient sits, the pain will be reduced. On rest, the pain will be reducing. And radiculopathy, the pain will be radiating based on the involved nerve root compression. And in severe compression form, there may be incontinence, weakness, and neurological signs may also be present. And one more is the ligamentum flavum hypertrophy. Usually the ligamentum flavum is 3.5 millimeter thickness. And if that hypertrophy happens, there will be narrowing and it will compress the existing nerve root, which can be better seen through the MRI. That's why I say MRI is the best choice of investigation in case of neurological conditions related to the back pain. And patient will be having difficulty in walking and standing, and there will be pain, numbness, tingling sensation, burning, and weakness will be present. So where we have to see the complications, or we expect the complication are called as the red flags. So the elderly patient who come with comorbidities having the back pain, or a patient with chronic diabetes mellitus presenting with the back pain, or who are under immunosuppression treatment, patient having the rest pain with neurological claudication and unexplained weight loss, trauma and fever may be a case of carcinoma or tuberculosis of the spine may be present. So in contemporarily, the management involves the rest, medication like NSAIDs and muscle relaxant, steroid injections, and pregabalin or gabapentin medication, nerve block or epidural injection, lumbar spine belt traction, and the surgeries like laminectomy, microdiscectomy, open or endoscopic type. So let me come to the what is told in the Ayurveda a little bit, and I will directly go to the treatment aspect. So once we take this disc area and the various structures, there are references regarding the Asti Dhatu, the Deha Dharana Karma, and Sthiratva is the function of the Asti. So Asti Dhatu is structurally a Kapha component, but functionally a Vata component. Astyashrayohi Vata. Vata is present in the Asti itself. And Vayur Ayurbalam, Vayur Dhata Shariranam, Vayur Vishpamidam Saram, Prabhu Vayuscha Kirtita. So whenever the Acharyas explaining about the Vata Vyadhi, and in case of various types of the pain, they are praising about the Vata, and invariably Vata will be present. So in the classical Samhitas of Ayurveda, so we can take from the Vata Vyadhi some of the causes for the back pain. Like for example, Vishama Upacharacha. So different Vega Sandharanas are caused for the back pain. Yana, Atapa, and Marmaghata, and Vega Sandharana. All these Dukkha Sharyasana, that is the postural disturbances. So all those are the different causes which can be taken, references can be taken to the Vata Vyadhi itself. So if you come to the Lakshanas, like there are some of these Tamba, Gatra Suktata, the numbness, and Bheda, Toda are the different type of the pain. And in case of Asti Bheda, as told us, Asti Kshaya Lakshana. So let me come to the treatment aspect. So these are the different aspects related to the diagnosis part. So once we consider the Chikitsa, in case of Gridrasi, that is a Chikitsa Sutra told as Antara Kandala Gulfam Sira Basti Agnikarma. So Siravyadha, Agnikarma and Basti Karma, Basti Chikitsa plays a very important role in the treatment aspect. So I'll take some references like Karyo Basti Gate. So Basti is one of the treatment told in case of various Vata Vyadhis, and in case of Snayu, Sandhi and Asti Samprapta conditions, we use the treatment with the Sneha, Upanaha, Agnikarma and Bandhana. In case of Sukti Vata, if there is a numbness is present, then Raktamokshana will be the best treatment. And Avagaha, Abhyanga and Basti, Siravyadha. If there is a Sarvanga Vata is present, Siravyadha will be the best treatment of choice. And Ekanga Vata only, specifically at a localized area, if the pain is present, then Shringa or Jalauka will be the best option for the treatment. So you can take the different treatment aspect from the Vata Vyadhi Chikitsa, Vata Rakta Chikitsa, Urustamba Chikitsa. If severe stiffness, severe neurological deficit is present, you take the principle from Urustamba. Typical sciatica, take the treatment principle from Gridrasi Chikitsa. Acute condition is there, take the treatment principle from Avarana Chikitsa. A chronic condition is there with muscle wasting, take the treatment from Dhatukshaya Avastha, like neuropathy symptoms, and Gatavata Chikitsa and Astikshaya Chikitsa. So these are the areas from where you can take the treatment principle. So in nutshell, the treatment involves the Agnidipana, Ammapachana, Srotoshodhana, Vata Anulomana, and if Avarana is the Avaranagna Chikitsa and Kapha Vatahara Chikitsa, the prime role of the treatment. And Avasthanusara Chikitsa, if there is the condition is in Amavastha, then do the Amahara Chikitsa. So Asti Dhatu Poshan, the supporting structures, if there is a degenerative condition is there, Asti Dhatu Poshana will be the choice of the treatment. So this Amapachana will be helping for reducing the inflammation, and Vata Nurmana will keep the Vata in the right direction, and Bhakya Chikitsa reduces the muscle spasm and increase the blood supply. And this relief of the pain can be explained well with the pain gate theory. So let me come to some examples of the medication which can be used in the cases of low back pain. Like we commonly use Rasna Saptaka or Rasna Panchaka Kashaya and Sahacharadi Kashaya with Gandharvastadi Kashaya and Rasna Yerandadi Kashaya, Ashwagandharishta, Balarishta, Abhayarishta. These are some of the that is there. If it is a Pitta involvement, Dashamula Kshiradhara may be utilized, and if it is a Kevala Vata involvement, then Tailadhara can be used. So Sahacharadi Kashaya or Gandharvastadi Kashaya or Gandharvastadi Taila with Shunti Kashaya give much better relief in selected cases of the back pain. And these are some of the medicaments, the tablet form, Chandraprabha, Ekangavira, Gopshuradi Gugulu, Trayodashanga Gugulu, Vishamushtivati, and Lambatun capsule and Makaradvijavati, and Tailas like Vishagarbha Taila, Sahacharadi, Saindavadi, Puttanchukai Taila, Mahamasha Taila, Pinyaka Taila. So there are few examples I have given which are well result oriented approach in low back pain with the utilization of Chandraprabha, Shilajatu, Ashwagandha, Balarishta, Gandha Taila and Tilarasayana, and utilization of Vidya Karma and Agni Karma, Siravyadha in selected cases, Marma manipulation and rehabilitation in Marma Bandha will give a better result in most of the back pain cases. So this is one example I'm giving. If you see the MRI, the patient had severe disc bulge, disc protrusion with the numbness and the pain was present. So this patient was treated with the Abhyanga with the Karpuradi Taila, so that to reduce the paraspinal muscle spasm, immediate pain relief was there. Then Sthanika Dashamula Kashaya Dhara has been given for 7 days, and Matra Basti with the Sahacharadi Taila was given for 7 days. And Yathoktam Yathadesham Chasiravedam Kuryat. If there is a severe pain is there, then Siraveda as the Avastika as well as Vyadhi Prastyanika Chikitsa. And in case of severe low back pain with the radiating pain is there, so Vidya Karma will be very much helpful. And that has been explained with the scientific background by taking different factors like pain, numbness, and what is the status of the SLR and the gait and tingling sensation before the treatment and after the treatment. Like this, you can make a chart and you can express in a scientific platform. So there we could see significant reduction in the symptom and radiological the Ayurvedic treatment with the 4 months of the treatment. So this is significant, I consider. If we are able to change the structurally itself, so then with the Ayurveda treatment, we can achieve a very good result in low back cases. And this was one more case where the patient had diffuse disc bulge, annular disc bulge, and there was a ligamentum flavum hypertrophy was also present. So this was treated with the same line of the treatment with the Ayurveda. And one more patient was treated with the who was having numbness, disc bulge, and severe nerve compression was there. So that has been treated with the similar Ayurveda line of the treatment. And here one more patient who had acute disc lesion with the spondylolisthesis was present. And in the second picture, you can see severe degenerative changes. So we have given him the Shamula Niruha Basti and Rajayapana Basti, and with the Ayurvedic treatment medicament. Well managed with only with the Ayurvedic treatment. Patient was coming with the wheelchair, and after the treatment, he was able to walk without any support. So this was one more case where there was the disc bulge, disc protrusion, and annular disc bulge, and the neuron. So which was treated with the Agnikarma and Vidyakarma. And Vyarya the Krita for the Dhatu. So the topic is very vast. I have tried to just reduce the time consumption just by highlighting on the clinical examination. So my aim is, before treating a case, just a diagnosis is the first criteria. Exact diagnosis will help us to treat the patient in a better way. So selection of the patient is also important. And when we are treating on the Vata Sthana. So it is a Sandhi is the Sthana of Kapha where Vata has entered. If there is a Kevala Vata is there, you can directly go with the Snigdha Chikitsa. But there is some Avarana condition is there, then you have to remove the Avarana by some Ruksha Chikitsa and then go with the second phase, Dhatu Poshana Chikitsa. So my aim is diagnosing the condition is first, and it is not the same treatment for all the back pain cases. We have to alert about the red signals in the spinal disorder. As I told, if the patient is having severe pain, neurological deficit, neurological claudication is present, along with the fever, compression features, you have to be alert. And convincing the patient is very important before starting the treatment after thorough examination. And do not jump into the treatment all at a time. All back pain cases are not the same. There may be some complicated condition. There may be some critical conditions which we may not treat also. We may have to refer the patient. So refer the patient in proper time. And sometimes you may complicate the condition. If you are not able to diagnose the fracture condition or CA condition, you may complicate the situation. And with the proper treatment, you can change the life of the patient. So after observing many of the back pain cases, confidently I can say that in many conditions like intervertebral disc prolapse, degenerative conditions, hypertrophy conditions, along with the neurological signs, we can bring a better result in the condition of the patient. Thank you.
Thank you so much, Dr. Shankar Prasad. Hello everyone. This is Dr. Usha here. I guess we will be having a lot of questions now. Let us take the questions. May I request the participants to please type in your questions once again, because due to some technical issues, the presenter was logged out. Even I was not able to join in. Could you please share your questions once again in the chat box? I request all the participants. Okay, we have one question by Dr. Rahul Gujia, who asks how to manage disc pathology with AMA or with inflammation. Hello? Hello? Am I audible? Team, if I'm audible, please drop in a chat. Okay. Dr. Shankar Prasad, are you still on the call? Dr. Shankar? Okay. Team, I'll try to connect with Dr. Shankar over the call. I'll request you to please be on the session while I attempt this attempt. Dr. Shankar, are you back in the call? Dr. Shankar?
Yes, ma'am.
Yeah. Okay. Doctor, we have few questions lined up in the chat box. Can I read it out, Doctor?
Yes. Can you hear?
Okay. We have a question by Dr. Rahul Gojia. Yeah, I can hear you, but I guess there is some kind of a disturbance, Doctor. I don't know if it's... Hello? Yeah, Dr. Shankar, can you hear me now?
Yes.
Okay. There's a question by Dr. Rahul Gujia, who asks how to manage disc pathology with AMA or with inflammation.
Yes, AMA can be reduced if there is a back pain. In the initial stage, we consider it as Amavastha, and that can be treated with just Lepa Chikitsa or Dara Chikitsa. Dashamula Kashaya Dara will be the best treatment. Or if the AMA is more, like if there is a Stambha, Gaurava, and Vedana is present, you can use any of the Rukshana Chikitsa for Amahara. We use commonly Dashamula Kashaya Dara or Dhanyam Ladara.
Okay, Doctor. Next we have annular tear present in disc L4. How to treat?
Can you repeat once again, madam?
Annular tear is present in disc L4. How to treat? By Namrata Kuralkar.
Yes. So the thing is, MRI will show the annular tear. So annular tear has been because of the why it has happened, whether it is a degenerative condition, whether it is because of the trauma, we have to identify first. So then it can be treated based on the same line of the treatment, L4, L5 disc level. We can do, if there is ama is there, we do the amahara chikitsa with any of the dashamulaka, any dhara or lepa chikitsa. And then once the amavastha is over, we can go with the brahmana chikitsa like katibasti and this matra basti or niroha basti. So then internally also medications to reduce that degeneration. That's all.
Okay, we have another question. Avascular necrosis, is there any treatment, sir?
So that is actually not related to this topic. Avascular necrosis commonly happens in the head of the femur. So if that condition is there, you have to take X-ray and diagnose that. And if you find out avascular necrosis, we have to increase the blood supply to that area. So in our experience, we have found Agni Karma will give a better result, and this St. Madhu Taila can be given along with the milk internally also, and Niruha Basti and Matra Basti will help in that condition.
Okay. Also, I would like to tell that we had maybe in the month of November, we had a session on avascular necrosis. So if you visit our YouTube channel, you must be able to access the recorded session of treatment of avascular necrosis. So I request you to kindly go through our YouTube channels for you to uh, have a detailed treatment protocols that was followed by Dr. Sachin TK. Okay. Do we have any more questions, participants? Okay. Treatment for spondylolisthesis, please.
Okay, spondylolisthesis is, we can consider it as like, it is like the dislocation type of the treatment. So it is nothing but it is overriding of one vertebra over the other. So here we should be careful, like we should not give very much compression, very much vigorous type of the massages. Otherwise, neurological compression will happen. Usually they will suffer with neurological compression. Do the manipulation. Manipulation will very much helpful. Identify whether there is any the irregularity, any of the irregular space reduction is there or not. Then locally you can give the rest to the patient, do the katibasti and matrabasti. That will help a lot.
Okay. We have another question. Disc pathology in Staulia patient and disc pathology in Krisha patient. How to manage?
Yes. Staulia itself is one of the cause for the disc pathology. If there is overweight is there, it will give compression, and because of that, the disc will herniate outside. So weight reduction itself is the primary treatment in case of obese patient. And in obese patient, if they are argha for the treatment, then you can go with the Shodhana Chikitsa. And we have to identify what is the level of the involvement. See, if the condition itself is more kapha involvement is there, then your treatment should be Rukshana Chikitsa initially, and it may take a lot of time for the treatment. In Krisha patient, if there is a degenerative pathology is there, then you have to go with the Brahmana line of the treatment. More of the Asti Poshana line of the treatment will be helpful.
Okay. We have another question. How to differentiate between sacroiliitis and sacralization during clinical examination?
See, sacralization can be best visualized with the help of X-ray itself. And sacroiliitis is one of the conditions which can be well examined at the clinical level. So I have told the test like Gillies test, Ginsland's test, and the pump handle test. So those tests will be helpful. And the sitting posture, if you are doing the SLR, that will be positive in case of sacroiliitis.
Okay. We have another question by Namrata Kurulkar. She asks, how to manage this diffuse at multiple level, maybe multiple vertebrae?
So it is same only. I'm not telling like you have to see the MRI and then treat the patient. You have to see the patient examine the patient, what is the presentation of the patient, whether it is like Kevala Vata, whether it is involved with the Vata along with the Kapha, Vata along with the Pitta, whether it is Amavastha or whether it is a Niramavastha, whether it is Dhatukshaya or Avranavastha, based on that, based on the presentation, you treat it. Because in Ayurveda, we have only Katishoola is there, we have Gridras is there, but the treatment should be based on the avastha and the presentation of the patient. So similar treatment, once you examine which avastha is there, then treat it according to that.
Okay. How to manage ankle ankle
Ankylosing
ankylosing
spondylitis.
spondylitis?
So due to the
Ankylosing spondylitis.
deficient time, I couldn't explain that. That's again a huge topic. Ankylosis is nothing but it is a fusion of the bones together. It may be bony ankylosis. Such condition, we have to treat it. The patient will be having bamboo spine, very much stiffness will be there. So in that condition, our Abhyanga, Dhara will be helpful. I'm not saying that we can't completely reverse the condition. It is a bit difficult to reverse the condition. And also there will be involvement of HLA-B27 factor, and it is an autoimmune condition also. So to reduce the complication, we can use some Rasayana Dravyas also in that condition, and it takes a prolonged time along with the physiotherapy treatment. Hello.
Hello.
Yes, madam.
Okay. Yeah. So I guess we have reached to the end of the session. So I see no more questions here. So with this, I would like to end the session with the vote of thanks. Thank you once again, everyone, for being part of today's enriching session. A special and a heartfelt thanks to Dr. Shankar Prasad, who was very supportive with us, who has kindly accepted our request, as well as he's been very enthusiastic about the session as well. And I'm sure everyone has gained real good insights based on how to treat lumbar pathology. I'm sure going forward, we will have much more sessions from Dr. Shankar Prasad. Uh, and we also extend our sincere gratitude to Ayur Central and Ayurveda One for their efforts in making this session uh, a possible success. For those interested in Ayurveda One product, our official contact details have been shared in the chat box. Please feel free to reach out. We're always happy to support your clinical practice. We look forward to welcoming you again in our upcoming Insight webinars. I would like to mention that now we have named our webinar as Insight, Connecting Knowledge to Clinical Practice. So hereafter, we will refer the webinar session as Insight. Until then, stay inspired, stay rooted in Ayurveda, and continue making a meaningful difference in your patient's life. Thank you, everyone. Thanks, and have a wonderful evening. Dr. Shankar Prasad, would you like to tell anything, or we'll end the session here?
Thank you so much for the opportunity, madam. Maybe the session, I was a little faster because the topic is a huge and couldn't cover all the information. But I hope there were some clinical hints which were very much helpful for the spot diagnosis. Most of the time, what we'll do is we will miss the diagnosis on clinical basis. Okay, so it's highlighted in my presentation. So once
Yes,
again,
doctor.
for the opportunity.
Okay. I'm very sure, doctor. I mean, the clinical hints that you gave were really useful. I was not able to start the session because I was held up with some other work, as well as my network is too patchy here as well.
Yes.
But going forward, this problem will not be there. And
Yes.
the recording of session, those who were not able to join the session from the beginning, The recording of the YouTube will be shared on the WhatsApp channel. So please check your WhatsApp channel for the further updates. With these words, I would like to end the session. Thanks once again, Dr. Shankar Prasad, and I thank all of the participants for your time and effort here. Thank you.
Thank you.
Yeah.